From the adult side, I think one big gap that I see is that the adult neurologists' knowledge of certain pediatric-onset epilepsies is still needs some improvement. So especially, like I said, especially some genetic syndromes. In the past, we used to get many patients that were investigated when they were young. They had the $1 million workup. They had all kinds of tests, EEG and MRIs and biopsies and karyotype and metabolic tests, but the diagnosis was not done. And then we would see these patients as adults and say, well, they didn't have a diagnosis, so we'll treat them as patients with what we used to call symptomatic epilepsy. Now, with next generation sequencing and all these advances, we are getting patients with STXBP1, patients with PCDH19, patients with SCN1A, SCN8A. So these are diseases that the adult neurologist was never trained to see, and it's really not familiar with their particularities in treatment and outcome and the long-term evolution of this condition. So I think we need to work on educating the adult neurologists on the genetic and rare epilepsy syndromes with onset in childhood.